Hi, my name is Dr. Fred Sylvester, and welcome to this episode of Health Talk. Today we have a return guest. A couple of years ago that you've been with us, Adrienne. Adrienne is a registered dietitian. She's owner and operator of Bodymetrix. Author now, I hear, as well.
So, author, podcast host.
My goodness, it's just amazing how things go and how everything unfolds for you. So, registered dietitian, we're here to talk about everything that you can imagine from obesity and health and moving into some of the, we'll say, the weight loss drugs that just have hit the market and that type of stuff. So I think the first place to start is just to have a better understanding of what BMI is. And we've talked about this before, but I think it's it's a metric that we as healthcare providers can use to say assess the health status and maybe the risks of future diseases. So what is BMI?
So BMI is a tool that practitioners use to assess body fat.
Sure.
It has its limitations,
Okay.
So obviously it can't account for muscle mass,
Okay.
but what it does is it's a good tool for the general public.
Okay.
So there's 7 classifications of BMI.
Oh.
All right, so we've got underweight, which is a BMI of anywhere between anything under 18.5.
Under 18, right, yep.
Yes. So, and I should add, when we calculate BMI, we're using a weight to height measurement.
Okay.
All right. So the nice thing about that is it's non-invasive. It's very easy to assess, right?
Yep.
I don't need to use body fat calipers.
Put you in a pool of water.
I don't need to do any of that stuff.
Yeah.
I can just get your height and your weight, and I can do a generalized assessment.
sure.
So that's why it's so effective. But anything under 18.5 would be considered underweight.
Okay.
All right. Anything between 18.6 and 24.9 is considered a normal weight.
Okay.
25 to 29.9 would be considered overweight.
Mm-hmm.
And then we have 4 classifications of obesity.
Oh, really? So I didn't know that yet.
We do, yes. So anything between 30 and 34.9 would be considered class 1
Okay.
obesity. 35 to 39.9 is class 2.
Okay.
Anything between 40 and 49.9 would be considered class 3, which
Okay.
we know more as morbid obesity.
Yeah, for sure.
And then class 4 would be anything over 50.
Okay. So you get, and I think the last time we discussed this, I don't even know if they had the classes at that time, on the obesity. They may have, but you just always felt that anything was above 30 was, thinking, you had just we'll say the traditional obesity that went on with it. I think the biggest thing that we want to look at is that a lot of people get caught up in these numbers, and sometimes the numbers give you some, we'll say, clinical pearls, and other times they can be overlooked, right? Because you can have a very fit person, male or female, have a quote-unquote higher BMI, but not truly reflective of their health status. Is that correct?
Correct, yes. I can remember a patient in particular that we worked with. He was trying to enlist in the Army.
Okay.
And he had an overweight, almost obese classification, but he had a 4% body fat.
Wow.
So clearly, again, there's limitations to any tool
sure.
that we use, but again, for the generalized public, it's very effective.
So when we start talking about BMI and using this as a metric and a data point, what's it really telling you? I mean, so you get this information, and you say you're in the obese category at this point. What does it open you up to? What does it not open you up to from a health standpoint?
Sure. Well, I mean, first and foremost, chronic disease
Okay.
is more prevalent when there is an obese diagnosis. So things like cardiovascular disease, high cholesterol, hypertension, diabetes, sleep apnea,
Okay.
even things like depression and anxiety
Wow.
sometimes are connected to that. Autoimmune disease, like pretty much any medical diagnosis can sometimes have a tie-in to having a higher BMI.
What's the prevalence of obesity and maybe overweight in
So-
America, world? I'm not even sure.
Yeah, I know in the United States, I believe it's 70% we're at right now. So 7 out of 10 people are either overweight or obese,
Okay.
which is significantly higher than it was, 50 years ago. I mean, if you think back to 1970,
Yeah.
right, when the movie Jaws came out.
Sure.
And you think about all the extras that they had invited onto the set to
Okay.
be on the beach.
Yeah.
You watch that movie, there was nobody
Overweight.
overweight at
Okay.
all. Maybe 15% of people were obese at that point in time.
Right.
And now we're looking at, over 40% are obese in the current state.
So in your clinical expertise, experience at this point, I mean, what do we attribute that from? How do we go from 15% in 1970, I'm assuming, to 40 or 70% here is sitting in 2025?
Yeah, I think it's a complex issue. I mean, I think it's a complexity of a lot of different things. I don't think we can point our finger at just one thing and specifically. I think, first of all, our food supply has changed over the past couple years. We have more ingredients, more chemicals in our foods that we might not know all of the long-term effects and how it affects our body. We're more sedentary, that's for sure. All right, accessibility to healthy food. Probably back 50 years ago, more people had gardens in their backyard, right? We don't have that as much anymore. Again, going back to accessibility, grocery stores are open 24 hours, fast food restaurants are open 24 hours. I know when I was a kid, like, they closed at 9, right? If you wanted food, tough. You either had to eat what you had at home or you had to wait till the morning till it opened again. Now we have things like DoorDash, where we have just completely made unhealthy foods more accessible. And I think probably we have higher rates of stress and burnout. People are overscheduled. So we've come to this point in time where we've traded convenience for health in the name of health. Most people that come in to see me, doesn't even matter their age, whether they're 20 or they're 60. They're like, I need quick, easy meals.
Yeah, for sure.
And even my retired community, I'm like, why do you need quick? What are you doing? Where are you going?
That's right.
They're like, oh, but I got to do this, this, and this. And so we have just learned to socially accept convenience over health.
So it's a cultural thing then. It has a big piece of what we're doing.
Absolutely.
I always kind of even kid to some of our patients, like, you can come out of our parking lot and you can make a left or a right, and within 100 yards, 200 yards, you're either hitting, a convenience store or you're hitting a pizza place. And, and so it's very easy, as you were just saying, to make temptations are there to make poor choices that influence people in a poorer pattern of health as well.
Sure.
So, when you start thinking about like disease and that type of stuff, one of the things I felt was very interesting getting ready for this show is that when we look at obesity and overweight, what I had said or what I had read is that obesity is probably leading to more preventable deaths than we could ever imagine. It used to be smoking, so smoking was a preventable death. If you eliminate smoking, that early preventable death. Now they're saying that obesity is moving in that trend where it's replacing smoking and being the leading cause of early death. Is that true? Correct? What do you think?
Yeah, I would say so. But I think the reason why nutrition, there's more complexity to it is because everybody needs to eat. Right? And so you have those challenges. Not only do you need to eat to live, but now you got to make the healthy choices, where smoking is, nobody needs to smoke per se, right? So now you've got this added a stress of trying to figure it all out and meet a basic need. And when the information is confusing or overwhelming to individuals, they tend to just go for whatever's quick and easy.
Well, I think it's fascinating because I've been to your clinic before, and and this is where I really want to get into. This is just kind of the intel. But when a person comes to you and they are looking for their expertise, your expertise on this, how does the system work? I think it's phenomenal. I'm kind of curious. Excited for you to share that with people.
A couple things. Well, first of all, we always do an assessment. So I always make sure that my clients know that we are not a cookie cutter facility, right? So we're taking a lot of things into account when we're creating a plan for that person. And we are creating a plan alongside of that person, right? I really do believe that, every client that comes into our facility, they have the autonomy to make their best decisions, and my job is just to help guide them in that direction, whatever that looks like. So when they come in, we're doing an assessment, medical history, past medical history, family medical history, preferences, right? Because again, I can't just hand out a meal plan for people to follow. If they don't care for the foods that are on that plan, they won't follow it. Right? So we're looking at preferences, we're looking at schedule, we're looking at family routines, because all of those things play an impact into the person's decision-making skills. So we want to make sure that we're doing a complete picture at looking at everything that could be contributing to their decisions. After that, we always start with generalized education because we want them to understand what's happening in their bodies. So I'm a firm believer that when, especially with adult education, when they understand what's happening in their body, without going too scientific, of course, right? But they take more ownership because they understand the direct impact of their choices versus saying, here's a meal plan, just follow it. And they're like, all right, I don't know.
Like when we consume stuff, it just doesn't disappear into a black hole, right?
That's right.
There's stuff happening.
There's consequences.
Yes.
Yes. And so we'll do that. Then we follow up, we do body composition screening. So one of the things that makes our practice unique is we use a sophisticated scale that allows for us to take a deeper dive into the person's physiology. So we know so much of your basal metabolic rate, which is how many calories you burn at rest, is based on your muscle mass. So we're looking at how much muscle mass does that person have, because again, going back to BMI, you can have an overweight classification, but if you have a lower body fat percent, higher muscle mass, we might be making different recommendations than if the opposite was true. So we do a body comp screening right away because we want to get a baseline measurement that also tells us how hydrated the client is, balance from left to right from a muscle standpoint. Just really gives us some good information, especially for our clients that are on the weight loss medications, the GLP-1s. We're finding that they tend to lose a lot of muscle mass when they're in their weight loss journey, which is not healthy for longevity standpoint. So it allows for us to keep a pulse on what's happening on the inside, even though they may be losing weight from a bathroom scale standpoint.
Yeah, they look different on the outside, but there's some other stuff happening on the inside.
Correct, yes. And then, we work with most people's health insurance plans. So I don't want to say that their health insurance dictates the amount of visits, but we do try to work within the scope so they don't have any out-of-pocket costs.
That's right.
And then another thing that we do that our clients love is we have a software system that we do snack and meal planning sessions. So we have over 7,000 recipes in our database, and I create my wish list. So based on your goals, so whether it be like weight loss, or we want to try to hit a certain protein amount or fiber amount, or for some people micronutrients, calcium, iron, whatever their deficiencies may be, I'll put in my wish list based off of the criteria that I'd like for your health, and then you as the client get to put in your wish list. So I want recipes that are going to take under 20 minutes, and I don't want any more than 6 ingredients at a time because I get overwhelmed, and I need to keep my recipes simple.
You can filter it.
And then I take our 7,000 recipes, we filter down both of our wish lists, and we might come up with 30, 40 recipes for each meal, and then I get to help you create a cookbook. Because if you've ever bought a cookbook before, you use 2 recipes, and then you're like, all right, this is useless. And now you have this book just collecting dust.
How about that?
And so I make your own cookbooks for you. And so that way you know what your family's preferences are. Because, I can give you all the great recipes in the world, but if your kids won't eat it, you're not going to make it. Right? If your spouse doesn't eat it, you're not likely to make it, and then that recipe is no longer helpful.
It makes sense. I think one of the things I wanted to kind of point out too is that when I was getting prepared for this, that we know that a pound of fat takes about 3 calories to burn to make it functional, right? And then a pound of muscle, I think, is around 35 calories per hour to fuel it as well. So when you're talking about basal metabolic rate and that type of thing, we're really referring to these 2 components in essence, where one doesn't require a lot of energy to make it alive, and one takes a heck of a lot more energy, 33 more calories, to make it actually function and do its job. So as we get older and we lose muscle mass, or we put more fat tissue on, a 2,000 calorie diet when you're 20 does not go to the same place when you're 60, or if you're out of shape or deconditioned, right? And so this also becomes an issue for us.
Yeah, I usually describe it to our clients as there's usually 2 major phases that our body goes through, right? So usually from around birth to about 30, we are in a growth phase, where our ability to grow is faster than our ability to tear down.
I like that.
Right? And then around 30, which I think is kind of early, but I didn't make the rules, right? So around 30 is where we start to notice a little bit of a shift, where we start to enter into that aging phase, where we start to tear down a little bit faster than we build up. So if we're not doing anything intentional to prevent that process from happening or to overcome it, we are just going to start to lose muscle mass every decade that goes on after the age of 30. And it's not going to be pronounced, right? You're not going to lose a ton of muscle mass between 30 and 40, but the process begins. And so being conscientious of that and figuring out, okay, what do I need to do differently to slow that progress down so that I can age well?
Yeah, for sure.
I mean, a lot of my clients that come in, they're very concerned with the here and now, right? Like, I want to look good now, I want to feel good now. And I agree. But I'm also thinking 30, 40, 50 years down the road, and I want to make sure that they're making decisions that are going to help them age well, not just look good now. And unfortunately, maybe they don't have somebody in their corner that is providing that service for them because
For sure.
everybody's so focused on what do I need to do right this second.
So kind of, one question before we close this one up. When you start to think about when you're looking at obesity and BMIs and using all this type of stuff to formulate a plan, the overall goal is what? Is it to look good or to be healthier? Or does it matter? Do you know what I'm saying? Is it a preference, a motivation for each individual person, or do you find a different theme that kind of connects us all?
It's a great question. I mean, it really does depend on the individual. I have some that come in, wanting to look better and feel better, but then they recognize the benefits of how they're feeling.
Sure.
And so then it starts to shift a little bit onto how do I feel my best longer, and what does this look like down the road? So, I don't ever judge anybody's motivation for coming in. I just want to make sure that they're doing it in a way that is healthy for their body. Obviously I wouldn't want somebody to do unhealthy things in the name of health.
For sure.
That doesn't make any sense. Again, to provide education,
Right.
to allow them to make their best decisions, but also support and then just accountability,
Yeah.
right? I mean, that's a huge thing
piece
that
of it, right?
people need. And like I said, people always have good intentions. I just want to make sure that they're doing it in a safe way.
Yeah. I just think it's interesting though, because when you start thinking about the number, the top 5 killers of Americans, right? You look at cardiovascular, diabetes, cancers, and that type of stuff. And everything you read, everything I read to get ready for this show at this point gives you an idea that obesity has a tendency to push towards all those things. So when you're thinking of that, you as being a healthcare provider, we see how much unnecessary suffering or premature death can be associated by how our habits are unfolding. And I guess that's where I'm trying to get from the question on where we're trying to angle that. As a clinician, as a healthcare clinician, what is your motivation? Is it more to change the outcome and a destiny of somebody on their health journey? Or is it the concept of, you buy into the concept of just making people look good? They look different on the outside, but they look good on the outside, but not so different on the inside. You know what I'm saying?
Yeah, I hear what you're saying. I want to respect the person's goals for coming in, but I think for me it goes so much beyond that.
Yeah, that's what I'm saying.
I think of like generational health.
Yes, that's what I'm
right?
thinking. That's what I'm getting after.
Just like generational wealth, generational health,
Yeah.
because I've seen the impact that decisions have made not only on people's children, but their children's
Absolutely.
children, right? And that is so rewarding for me
Yeah.
because I know that, not only am I impacting the life of that person in front of me, but all the people around them.
Absolutely.
And it's hard. Nutrition can be challenging because there's a lot of information and it's a lot of extremes, like
Sure.
are eggs good or are they bad? Who knows, right?
Right.
And so a lot of people come for that education piece, but
Yeah.
when they start to recognize that they have the capability to make better decisions for them and their families, it's such a privilege to be able to work in that
wonderful.
field.
So take home message for our community. What do you think?
So, I would say if you are struggling with obesity, you don't have to, right?
Okay.
You don't have to do it alone. You don't have to carry that burden alone. And so enlist in help, right?
Yeah.
Obviously, a professional like myself, the one that takes health insurance can be very helpful, so
For
you
sure.
don't have that out-of-pocket cost. But somebody who's going to listen to you, somebody who's going to take in the information and, not just throw out a cookie-cutter plan, but actually is listening to what you have to
Sure.
say. I always say when it comes to weight loss, we really need 3 criteria.
Okay.
All right, so number 1 is before you make any changes, you have to ask yourself, do I see myself doing that in 5 years? Because I think one of the biggest fallacies to weight loss is that you will do a weight loss plan and then there's a separate maintenance plan.
Okay.
Right? There is no separate maintenance plan. Maintenance
right.
is just more of what you did in weight loss.
Right.
And so if there is no longevity to the decisions that you're making, you're just planning on doing it for a finite time and then are going to go back to your old habits,
Sure.
you'll go back to your old weight.
For sure.
Right? So you've got to make sure that, this is a lifestyle change. You've
Gotcha.
heard of that word many times, a lifestyle change, something that you can be consistent with. So that's number 1. Always ask yourself, do I see myself doing this 5 years from now?
Okay.
Number 2, do you like what you're doing? The quickest way to quit something is do something you hate.
Makes sense.
Right? But people are willing to do it for short term in the name of losing weight or being thin.
Sure.
But there's no sustainability, so now you've basically canceled out criteria number 1
Yeah.
because you have no longevity.
You're right.
And then number 3 is it working?
Okay.
Because you can like what you're doing, right? You can see yourself doing it 5 years from now, but if it's not giving you the results, you know, being flexible enough to know when to pivot.
Okay.
And then also going at it from a place of curiosity versus judgment.
Okay.
Your mindset is one of the most important things when it comes to weight loss.
Wow.
And that's where we help people see things a little bit differently, have a different perspective. And if you can go at it with curiosity instead of judgment, you're going to find that, you know, that weight loss is going to happen so much faster. Compassion is always a precursor
For sure.
to curiosity. And so really helping people work through the mindset piece. You know, a lot of us grew up watching Biggest Loser, where Jillian Michael was screaming in their face, and we think that that's what we need to be successful, but we actually need the compassion piece as well.
I like that too. So there we have it. You know, when you talk about a wealth of information that you have and what your clinic brings to our community, it really adds a lot of value to every person who is able to meet with you, and you know, you're able to take underneath your wings. So it's a privilege to have you on the show, and respect, you know, greatly what you guys do down there. So good day and good health.